Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Dear friends, we shall discuss psychiatric disorders in today's vlog. We shall discuss what are the different types of psychiatric disorders, what are the causes and risk factors to develop these disorders, how do they present in clinical practice, how we can diagnose that who is suffering from which psychiatric disorders, and then we shall discuss the treatment options which we can offer to a patient having any sorts of psychiatric disorder. As mentioned in the intro, topic for our today's discussion is psychiatric disorders. So, what are psychiatric disorders? Psychiatric disorders are mental health conditions that affect thoughts, feelings, and behaviors. What are the types of psychiatric disorders? The major psychiatric disorders include mood disorders like depression and bipolar disorder. Number 2, anxiety disorders, which include generalized anxiety and panic disorder. Number 3, psychotic disorders. These includes schizophrenia and schizoaffective disorder. The fourth psychiatric disorder is personality disorders. For example, borderline personality disorder and narcissistic personality disorder. The fifth type of psychiatric disorder is trauma-related disorders. For example, post-trauma stress syndrome and complex trauma. The seventh type of psychiatric disorder is eating disorders, and this include Anorexia nervosa and Bulimia nervosa. And the eighth most common psychiatric disorder is substance-related disorders. These are addiction and substance abuse. So these 8 types of psychiatric disorders, they're the most common one. And when we see a change in thoughts, feelings, and behavior of someone, it's a high probability that that person is having some sorts of psychiatric disorder. And he or she should consult the doctor so his possible or her possible psychiatric disorder is evaluated, is diagnosed, and offered treatment in time. Remember, most of us in our today's modern era having one or another sorts of psychiatric disorders, ranging from the mild severity to very high severity. Even people around us who are at very high level of their life positions, they may be having psychiatric disorder. So, point is, when you feel that there's change in your thoughts, in your feelings, or in your behaviors, or you see changes in the thoughts, feelings, and behavior of your relatives, your friends, your colleagues, it's important that the proper medical advice is sought, and if there is any psychiatric disorder, that should be treated. So, after knowing the different types of psychiatric disorders, let's see what are the causes and risk factors to develop these psychiatric disorders. There are many causes and risk factors, but the most common which we should be knowing is genetic risk. We see families having psychiatric disorders within their families. So genetic predisposition is number one cause or risk factor. Second is brain chemistry, the imbalance between different neurohormones. I have already discussed with you the neurotransmitters, neurohormones in one of the vlogs. So imbalance between these sorts of neurotransmitters and neurohormones, it leads to psychiatric disorders. The third cause, and one of the most important causes, is life experiences. If someone has experienced trauma, stress in his or her life, especially in the childhood, it leads to psychiatric disorder later on. Then environmental factors like social factors, cultural factors, common factors in the community, in the society, all these may affect the psyche of a person, and he or she may have psychiatric disorder. Then there are medical conditions, for example, thyroid disorders, hypothyroidism, Cushing disease, other diseases. They lead to psychiatric disorders. Substance abuse, one of the most common cause for psychiatric disorder is, and unfortunately, it's a very common issue in West as well as here in Pakistan and other countries. And then family history, and I have already said that there is a source of genetic predisposition for these people to have psychiatric disorders. Well, how these people they present? The symptoms or presentation varies depending on disorder. But common symptoms include mood changes. People may feel depressed, unconcerned, not connected with their surroundings, unconcerned with his, her surrounding, or the mania, being very happy, disproportionate happiness. Then anxiety or fear, this is another presentation. Hallucinations, delusions. The third symptoms of psychiatric disorder. Impulsivity or aggression. We have seen people presenting with aggression, very aggressive behavior. Then social withdrawal. They are happy when they are alone. They are not happy in the crowds, in the people around them. Sleep disturbances. Either there's poor sleep, no sleep at all, or sleep most of the times. And of course, appetite changes. Some of them, the appetite is lost, and some of them, they are overeating, bizarre present habits of their appetite. So all these symptoms may we see in one patient are depending upon the psychiatric disorder. In today's vlog, we are discussing psychiatric disorder as a whole. This will be followed by taking one psychiatric disorder at a time and seeing that in detail. So today's vlog is an overview of psychiatric disorders. So different psychiatric disorders present with different symptomatology, but as I said, the most common symptomatology is mood changes, depression and mania, anxiety or fear, hallucinations, delusions, impulsivity, aggression, social withdrawal, sleep disturbances, and appetite changes. How to diagnose? How we diagnose that someone is having psychiatric disorder? One is comprehensive diagnostic evaluation. There are proper psychological assessment tools which the doctor will apply. They will ask questions, they will mark, and then they make a diagnosis whether you or some of your relatives and friends is having psychiatric disorder or not. Then the medical history. This is very important. We take the medical history. We do the physical examination to look for any other causes. And of course, the diagnostic criteria, medically, this is DSM-5 or ISD-11. So these are different criteria, and we apply that, and then we diagnose if a patient has got psychiatric disorder, yes or no, and if yes, then what type of psychiatric disorder. Once we make a diagnosis of diagnostic disorder, what are the options, how we treat them? Of course, psychotherapy is very, very important. It includes cognitive behavioral therapy, the psychodynamic therapies. Then pharmacotherapy, it has got a role. And different sorts of antidepressants or antipsychotics, they are given to these people in a hope that neuroanatomy, the neurophysiology will be, not the neuroanatomy, the neurophysiology will be restored, and their psychiatric or the mood changes will be normalized. Then behavioral therapy, for example, exposure to the surroundings from which they are afraid, response prevention. So different sorts of behavioral therapy are there. Then lifestyle changes. This is very, very important, that a positive lifestyle change should be offered, and they should adopt a positive lifestyle in terms of exercise and mindfulness. And of course, social support, family support. This is very, very important for people having psychiatric disorders. So, dear friends, in today's vlog, we discussed that psychiatric disorders are mental health conditions that affect thoughts, feelings, and behaviors. The major psychiatric disorders, they include mood disorders, anxiety disorders, then the psychotic disorders, personality disorders, trauma-related disorders, neurodevelopmental disorders, eating behaviors, and substance abuse. And we saw that the causes are genetic causes, change in the brain chemistry, life experiences, environmental factors, medical conditions, substance abuse, and family history. And the symptoms depend upon the underlying psychiatric disorders, and it may range from mood disorders, mood changes like depression, mania, to anxiety or fear, hallucinations, delusions, impulsivity, aggression, social withdrawal, sleep disturbances, and appetite changes. And different sorts of diagnostic tools are applied. And in the treatment, we have got psychotherapy, we have got the pharmacotherapy, behavioral therapy, lifestyle changes, and support to these patients. Dear colleagues, I stop here. In the coming vlogs, we shall discuss these psychiatric disorders one by one seeing what do we mean by that specific disorder, what are the causes of that, how they present, and how we can diagnose and treat that particular disorders. So be with me for the coming vlogs on psychiatric disorders, one by one discussion. Thank you. Take care. Khuda Hafiz.